You experience many changes as you go through pregnancy and childbirth.
And hold it down there. 1, 2.
After your baby is born, you enter another period of intense change, the postpartum period. This program is designed to help you take care of yourself, both physically and emotionally, while making the transition from pregnancy to motherhood. You may experience afterbirth pains that feel like menstrual cramps. These may occur as your uterus contracts or shrinks down to its pre-pregnancy size. Breastfeeding helps stimulate these contractions, so the pain may coincide with feedings.
So now we're going to check your belly, and we're just going to feel for your uterus and make sure that it's going.
Your uterus will continue reducing for approximately 6 to 8 weeks before it returns to its normal size. If you have excessive bleeding, or your healthcare provider determines that your uterus isn't contracting correctly, you'll probably be asked to massage your uterus. This can help decrease postpartum bleeding by helping your uterus contract and feel firm again. To massage the uterus, firmly press into your lower abdomen with a cupped hand using circular motions. Do this massage 3 to 4 times per day for 3 to 4 days. For several weeks after birth, you'll experience a vaginal discharge of blood from your uterus called lochia, whether you've delivered vaginally or had a cesarean section. This is a result of the uterus cleansing and healing itself. Lochia is normally heavy and red for the first 8 hours after birth. Then it turns to a darker red for 3 or 4 days, and gradually becomes pinker until about day 10. Then a yellowish clear discharge may continue for 3 to 6 weeks after birth. Be sure to wear sanitary pads, but do not use tampons or douche. Lochia smells earthy, but should not have a strong or unpleasant odor. If your lochia smells foul, contact your healthcare provider. This could indicate an infection. Also call your healthcare provider if the amount is heavier than your normal period, or if the bleeding is bright red.
It's going to be a little uncomfortable. Your bottom's been swollen from pushing. It's normal. So what we'll do is we'll keep ice on your bottom for about 24 hours, okay?
Expect some pain and soreness after a vaginal birth, especially if you've had an episiotomy or small incision to widen your birth canal. To help relieve swelling and soreness from an episiotomy, apply an ice pack to the tender area for the first 24 hours. After the first day, your physician may ask you to take a sitz bath. To prepare a sitz bath, you'll need to fill a small basin with warm water and place it on the toilet. Sit in it for at least 20 minutes, 3 to 4 times per day, for about a week. Sitting in a shallow tub of warm water can also help relieve soreness. Many new mothers find they have hemorrhoids. Hemorrhoids are swollen blood vessels, usually caused by the strain of the contractions and pushing during labor and delivery. To reduce discomfort, avoid constipation by drinking plenty of liquids and eating leafy vegetables, fruits, and grains. If this doesn't help, ask your healthcare provider about using a stool softener or a mild laxative. Use witch hazel to lessen the pain of hemorrhoids or an episiotomy. Place pads soaked in witch hazel on a sanitary pad in your underpants, or use them to blot the sore area. Your healthcare provider may also recommend pelvic floor exercises called Kegels. They are designed to help you tighten the muscles stretched during birth and speed your healing. To become aware of the pelvic floor or Kegel muscles, contract or tighten the muscles deep inside you as you would to stop the flow of urine. However, you should not practice Kegels each time you urinate, because you will not empty your bladder completely. Instead, make a habit of practicing a set of Kegels sitting, standing, or lying down. Hold as tightly as you can for 3 seconds and relax for 6 seconds. Do 10 Kegels in a set and 3 to 5 sets each day. If you've had a cesarean section, your recovery will typically be longer than a vaginal birth. It's a good idea to have someone stay with you for the first few weeks to help you care for your baby while you physically recover. Avoid lifting heavy objects or doing anything that would strain abdominal muscles, including strenuous exercise. During pregnancy, your body has also been preparing to feed your newborn baby. 2 to 4 days after birth, your breasts may become engorged with milk. Engorgement causes breasts to feel tender, full, and hard, and may last for 48 hours or longer. If you are bottle feeding and experience engorgement, avoid rubbing or stimulating your nipples, and do not express any milk, since that will encourage milk production and prolong your symptoms. Call your healthcare provider if you continue to have problems. To relieve the pain of engorgement, wear a supportive bra and apply an ice pack to your breasts for 20 minutes every 4 hours during the day. For breastfeeding mothers, engorgement may make it difficult for the baby to latch on. Before feeding your baby, you can stimulate milk flow by warming your breasts with warm compresses or by taking a short, warm shower. After feedings, ice packs applied for 10 to 15 minutes will help reduce the swelling. Engorgement is likely to occur if the baby has not been nursing frequently, has not been latching on properly, or if you have been limiting the baby's time at your breast. Another physical change you may experience is night sweats, which may occur 2 to 3 days after delivery. This is your body's natural way of releasing retained fluid. However, you should call your healthcare provider if you experience any of the following during the first days or weeks after birth: increased vaginal bleeding or passing a large clot, foul-smelling vaginal discharge, fever above 100.4 degrees, or flu-like symptoms, burning, bloody, or frequent urination, phlebitis, which is a tender red area on the leg that feels warm, or painful breasts with red spots or streaks. Along with the physical recovery from childbirth, the change in hormonal levels can lead to a wide range of emotions, both ups and downs. The downs are sometimes called the baby blues and are due in part to changes in hormonal levels, poor eating habits, fatigue, inexperience or lack of confidence with newborn babies, loneliness or isolation from other adults, and the constant full-time demands of an infant. For most new moms, the baby blues decrease with time and sleep and disappear within a few weeks. But if these feelings continue, you may have true postpartum depression. Symptoms of postpartum depression include excessive worrying or crying, extreme changes in appetite, the inability to sleep, and the inability to care for your baby or yourself. If you experience any of these symptoms while you're in the hospital or when you get home, don't wait for them to go away. Talk to your partner and seek professional help. In some cases, medication may be prescribed. Many times you'll feel better and learn more about the emotional and physical responses you're having to motherhood by joining a postpartum support group. Caring for a newborn can be very demanding, but you must take care of your own health needs so you can also take care of your newborn. One very important way to care for yourself is to make sure you eat well. New mothers often don't eat properly and are more likely to experience greater fatigue, a slower recovery, depression, and decreased milk supply. For proper nutrition, you should follow the food guide pyramid. The pyramid divides food into 6 groups: grains, vegetables, fruits, dairy products, proteins, and fats, oils, and sweets. Most foods you should eat should come from the bottom of the pyramid: grains, vegetables, and fruits. You should eat fewer foods from the protein and dairy groups, and very few choices should be from fats, oils, and sweets. Breastfeeding mothers need approximately 500 more calories per day than usual to produce milk. Talk with your healthcare provider about your eating habits or any other changes you need to make. A good time to do this is at your health checkup, usually about 6 weeks after delivery. Some women are concerned about the pounds they've gained during pregnancy.
I still have a ways to go.
With proper nutrition and regular exercise, you'll gradually take off the extra weight. Check with your healthcare provider about how to ease back into your exercise routine or start a new one. Remember, it took 9 months to put on those extra pounds, and it's unrealistic to expect them to go away overnight. There's a lot of information available from your healthcare provider, so take advantage of it. If there's something that you don't understand, ask again.
Do I still have to take these vitamins?
Be sure to discuss with your healthcare provider whether or not you should continue taking your prenatal vitamins. And finally, if you plan to work after the baby is born, your healthcare provider can give you the final okay to return to your job. A good way to help you feel stronger physically and emotionally is to take regular walks. Walking is a good activity. It's something the entire family can do together. Remember, this is an important time to bond as a family. It's also important for others to support Mom. Let her know what a great job she's doing and try to help out whenever possible. As a new mother, accept all the assistance that comes your way and learn to ask for help. If you're a single mom, make sure you have a friend or relative to stay with you and help for a while. Dads, relatives, and friends can make Mom's life easier by preparing meals, doing laundry, helping with chores around the house, making trips to the store, and helping look after other children in the home. Having a baby may make it seem like you and the baby's father never have time to be alone together anymore. Friends and relatives can help you find time away from your baby to renew your relationship as a couple again. As soon as you feel up to going out, try to make plans to see a movie or to go out to dinner. Sex may or may not be on your mind. Most healthcare providers recommend waiting 3 to 6 weeks after delivery before resuming sexual activity. At that time, one thing you must consider is birth control. If you're bottle feeding, your menstrual period can resume as early as 4 weeks after delivery or as late as several months afterwards. Many women who breastfeed may not have a menstrual period for several months, or perhaps even until they stop breastfeeding. However, you can become pregnant before getting your first period. And yes, even nursing mothers can become pregnant. Birth control pills can decrease your milk supply, so if you're nursing, you may want to consider an alternative form of contraception, such as condoms or spermicide. You can usually return to the pill within a few months. If you used a diaphragm before your pregnancy and want to continue using it, see your healthcare provider to have it refitted. The 6-week postpartum period is a time of tremendous change, both physically and emotionally. Give yourself the chance to get to know your newborn, to rest, and to heal. Only time and experience can help you make this transition so you can enjoy the pleasures and meet the challenges of motherhood.